on to another level of hormonal disorder amongst women in reproductive age. I'm talking about Polycystic Ovary Syndrome. We call it PCOS or PCOS. Now, of course, we want to know more about it and how it works, what it actually means, and of course, who it affects, and how you can get over it, if it's something that can be cured, if it's a disease. What exactly is PCOS? We will not be doing this conversation alone because we have our guest here with us this morning. I'm talking about Ahmadu, Fatima Binta. Good morning. Thank you very much for joining us this morning.
Thank you so much for having me.
Yes, thank you for always coming through for us.
It's always a pleasure.
All right, so our conversation this morning is on PCOS, that's Polycystic Ovary Syndrome. What exactly is it?
Well, Polycystic Ovarian Syndrome, like you said, PCOS, it's imbalance. It's an imbalance of the reproductive hormones in the body. It's caused by excessive productions of testosterone, the male hormones, and androgens, high follicle producing hormones, and it causes an imbalance in women. As early as their first menstruation, they begin to notice it. So that is exactly what Polycystic Ovarian Syndrome is.
Okay, and what are the signs and symptoms of this Polycystic Ovary Syndrome?
The signs and symptoms include irregular menstruation, there is a pain, and gradually the women begin to notice hirsutism, that's excessive growth on the face, on the chin, even at the back, on the buttocks, on the legs. So we'll find out that when that begins to occur, then the women know that there's actually, an issue. And even hirsutism in some women actually cause some women to have a very masculine body structure, unlike the curvy, shape of the woman. And the voice, becomes hoarse, Yes, over time, So those are some of the symptoms that the women are most likely to experience, and then you know that there is a problem somewhere. With time, it's actually the symptoms also, should I say, degenerate into cardiovascular diseases. Yes, and of course, miscarriages, high infertility, and type 2 diabetes.
Whoa.
Yes.
So if this is very serious, like you've explained right now, what exactly is the cause of PCOS? How would how can you get it? Like, is it a disease, or what can you do that would make you get, HIV and AIDS or STIs and STDs, that there are certain activities that you'd have to do to get it. Or for PCOS, what do you do?
Well, for PCOS, it's not exactly, it's partly what you do and what you don't do. Mainly, and should I just say, the major reason why women have PCOS is because it's genetic.
Interesting.
It's genetic, so it's it's like, should I say, a transference from the father and the mother, the chromosomes, when the parents are copulating, and they're just basically, yes, it is genetic. So it's usually transferred, from maybe the mother, from the mother to the daughter. And there are other reasons that may cause it, but those are very, it's like 1 in a million. We have there are 4 types of PCOS, by the way. We have the pill-induced PCOS. We have the inflammatory-induced PCOS. We also have the insulin-resistant PCOS, So, and then, of course, the eating-cause PCOS, that's the genetic. But majorly for almost every woman, like in Nigeria, we have a statistics of about 1.5 women yearly, having PCOS. So, and out of that, you find out that about 1 million is genetic. So the main cause of it is genetic.
So what you're saying is you don't have to engage in any activity. Like, even when it's not genetic, there is no way you can get it aside it being genetic.
Well, yeah, like I said, it could be induced by your insulin. It could also be caused by pills and inflammation, but basically it's genetic. So it's not about, it's not about what you do, what you don't do. So For instance, if you have in the family somebody that has had it before, there's a 70 to over 100% chance that, yes, the other females in their family would also have it.
So it's just prone with females. It's prone.
Yes,
Females are just
yes,
prone
yes.
to it alone.
It's a female disease, so to say,
yes.
yeah.
How can it be avoided? How can it be treated?
It can be avoided by watching our weights, by living a healthy lifestyle, and most importantly also by taking supplements. So the moment a female begins to have a menstruation and she notices that, my body isn't telling me what it's supposed to tell me, it's not doing what it's supposed to do, and I'm feeling some awkward signs, right from puberty, when, you're supposed to be having the growths, the hair growths under the armpits, and then the female notices that, okay, some of this growth is coming around my chin, there's a beard, there's a mustache. Why am I having such hair on my buttocks, on my back, and even the leg, it's so hairy, on my chest, then, that's physical enough for anyone to know that, yes, there is a problem. And, there are several treatments that can be given depending on the type of PCOS that comes up with it. For the younger ones, if it's the hirsutism, they can be treated with injections of estrogen and progestin, just to reduce the androgens and the testosterone. Those are the male hormones, that are causing this. So, in essence, you can just say that polycystic ovarian syndrome is the excessive production of male hormones in a female body. That is an abnormality, So it's like the body is telling the woman that, look, I'm a man, or, so to say, I'm a man in your own body. And of course, there are female reproductive organs, and that causes an imbalance, in the hormones. So what the androgens are not supposed to be there, the testosterone is not supposed to be there, the high follicle stimulating hormones is not supposed to be there. So when it's present in the body, so the woman begins to have those characteristics of the man, and of course the woman is pregnant, and the body will be telling you. As a matter of fact, it doesn't even allow women.
Be pregnant.
You shouldn't be pregnant,
Exactly.
So before you know what's happening, there's a miscarriage, because the hormone, the estrogen, and the progestin in the woman's body is depleted, reduced. So you are having the presence of the male hormone. So then definitely there's going to be a miscarriage, and then depending on how high the male hormone is, the woman would not even get pregnant, and if she manages to get pregnant, it would lead to a miscarriage.
So is there a chance of recovery? Because now this looks very scary. Imagine you didn't do anything, you don't know anything, but you inherited this genetically because of your parents and all of that, and then all of a sudden you realize that your menstruation is irregular, you start to grow hair on your chin, you start to, your voice gets coarse and all of this. Like, you've been taking a lot of, you talked about injections on estrogen. Yes, and then you're doing all of that, but it's not really working out for you. Is there a chance that you're going to get totally recovered from this?
Well, yes, there is a chance. There's a chance that the total recovery, all the woman has to do is to follow the routine, and the treatments, the prescriptions that the doctor, is giving to her. She has to be disciplined, so to say, to follow through. Like I said earlier on, she's going to be put on injections, on drugs. So if she follows it, over time, I know that the body would adjust, She brings the body to adjust, and then she has to follow a healthy lifestyle, weight loss program. Most of the time, you find out that even with the woman, with such high levels, she's bound to have very severe weight gain, so to say, because the metabolic system is already disturbed, So when she eats, so to say, the food doesn't go through it's not the proper metabolic rate is not being followed by our body system, So there's a disturbance, both metabolism and catabolism, everything is totally imbalanced. So if she follows through with what the doctor has put her through, diet, exercise, and the drugs, definitely with time she will definitely get better. So it can be managed. That's why I said earlier on, I said the woman has to be careful, so that it doesn't degenerate, to type 2 diabetes and other cardiovascular diseases. Yes.
Okay, so I believe people like this are often stigmatized. Imagine going on the road and then you see a woman with beard, hair on her chest, extremely hairy. There's a certain way people see them. There's a certain way people look at them. How would you say they can deal with stigmatization?
Well, yes, we do have quite a number of women, Most of the times, we've had women coming into the hospital, and, the next thing they tell you is, oh, doctor, why is this happening to me? Yeah, why is this happening to me? I mean, I'm female, why am I having hairs? And it's not even just the hairs, for some women, they have thinning, the thinning of the hair. We talk of the excessive growth,
Yes.
But some other women also have thinning of hair. Like for the men, when men are bald, you have the circular thing on the frontal, and then you have the ear to the ear, just across the back, there's a line that goes through, so, and then around the head. So we have that as well. So for women too, it happens. So the woman is bowed, and, other women look at her and like, I mean, what's going on? Women are known to have a lot of hair on their head, So the head is bowed, and then the chin has a mustache, and then there's hair, and, some women even have the hair on their, on the esophagus, on the throat,
Yes.
and it's as if a woman can come and say, oh, I feel this hair is even going right inside, so, so for the stigmatization, the truth about it is the women just have to be comfortable about themselves. That's just the truth about it. It's almost similar to the case of cancer patients. There's nothing you're going to do. There's going to be hair loss and maybe weight loss, and you just have to love yourself for it. That's where the therapy comes in, That's where we have the therapy. For those that are stigmatized, of course, we have treatments like laser treatment, electrolysis, and then, of course, in the process of taking the drugs and the medication, we have letrozole. We use birth control pills to take care of some of these symptoms that comes up, And in that process of doing all that, you find out that gradually the women lose the hair. Of course, the high levels of the drugs that they're taking in actually removes the cyst. Polycystic ovarian syndrome is just like when you look at it under the microscope, it's like having little water, like water bubbles or soap bubbles or marbles, placed on the ovaries. So yes, based on the ovaries when they're not supposed to be there excessively. So that's the androgens and the testosterone, And by the time you begin to use those drugs, that the doctor is prescribing, and effectively, gradually the hairs are reduced. The voice, becomes thinner, more feminine. Yeah, it becomes the pain too is reduced, and of course with the weight loss, So with that, I think the women can be confident, can be confident to actually say, look, that. Once you notice that there is a difference, it may not totally go. That's just the truth about it, because, the moment the medications, some of us, when we're not disciplined, if we do drop our medications and our lifestyle, yes, the bones may be triggered again because it's in the system. It's in the system.
Medications, something you have to be taking.
It's a lifelong.
Forever.
Yes.
Wow.
Or you go on a lifestyle pattern. For those that are lazy, to follow with medications throughout, yes, so you just go on a lifestyle pattern. You eat healthy, like when you're talking about the remedies, some of the home remedies, yes, so you also have those that have decided, okay, look, I want to go on a healthy lifestyle pattern. So for those that have polycystic ovarian syndrome too, they can also go on a healthy lifestyle pattern along with the medication and the drugs, and like for the hair now, for those that are stigmatized, they can go for the laser removal, and that solves a lot of problem, but they have to be confident.
Well, I mean, this is a new world that you're uncovering, and like you said, the statistics saying that 1.5 million people
every
actually
year
go through
in Nigeria alone.
In Nigeria alone, and people don't even talk about it. Because I mean, the stigmatization, the kind of pain that they're going through would allow them to just, keep quiet and be in their own bubble. If this is not treated on time, what happens?
Well, if this is not treated on time, you have, let me just put it, in the stigmatization terms of people that come in, you have a man in a woman's body, so to say, that's just, on a light note. But if this is not treated, you have women coming up with obesity, you have women coming up with heart attacks, stroke, you have women coming up with severe kinds of cancer, you have women coming up with type 2 diabetes, and then you have women coming up with osteoarthritis, which is so common, in women. So women need to, we need to be more, careful about our health. We need to pay more attention to our health, because most of the times, when we see other women, I think part of the stigmatization, we just tend to smile, or we just give that look that, why is she having a beard, or why is she keeping a beard, not knowing that probably she even shaved yesterday, and maybe in 2 days' time, maybe she's not had the time to shave, and she's already, it's grown again, So that's just part of it. And I think most of the psychological problems, even sometimes even worse than the stigmatization, is actually the inability to conceive. So the woman tells you, I'm having irregular periods, or I menstruated yesterday, just like what you were talking about, for some people, you find out 32, you were saying, you didn't know where that 32 was, well, yes, it is, it happens. When we have people that have 32 menstrual cycle dates, very abnormal.
Interesting.
Yes,
Instead of the 28
Instead of the 28, some people have 22, 24, 26, 28. That's normal. 22, 24, 26, 28, even 30. Some people 30, but when you have 32, 36, and then the next month it doesn't come again, and then it comes in about 3 months, it's irregular because of the androgens and the testosterone in the female body. Then you also find out that such women don't even ovulate. There is no way they're going to ovulate, because already the presence of the male hormones in their body is already telling them, look, you're a man, so to say, if the hormones could speak, would say you're a man, So there is no how they ovulate. And then obviously if they're not ovulating, that means that their ovary is not producing eggs. So how do they get pregnant? So there's even much more stigmatization from that angle from women. And, everything the man tells you, I'm okay, and the woman is like, so what's the matter? And the doctor says, I'm okay too, The doctor says, I'm okay. So it's just this ovarian cyst that is causing all this. And it causes excessive bleeding, in most women. So it's not the time of their period. And then for some women too, they could even see the period in quick successions. So they could have their period this week, and next week again, they're having another period. So it becomes, sometimes it becomes very cumbersome for the women, with the severe pain. And sometimes it even seems as though, they're just like, they want to have a baby, but that's not it. So it's a very severe case.
Okay, so you've talked about how eating healthy is very important for people with the PCOS. Now, what are the kind of foods you would recommend for people? Are there foods that actually aid, more of female hormones? Are there foods like that?
Yes.
What kind of foods?
We have flax seeds, we have mint leaves, we have licorice, we have the garlic, we have ginger, we have ephedrine, those are the local ones that are so close to us here. Eating broccoli could help, cauliflower could help, asparagus could help. So all those foods are very good. Of course, with the vegetables, the spinach, the ugu, and, so basically vegetables, fruits, and lots of good, healthy, just living a healthy life. Yes, basically. So that helps a lot. And then, of course, also practicing yoga could also help. Acupuncture could also help, and acupressure too is also, they're also good remedies, for women with polycystic ovarian syndrome. So there's a whole lot to it, But basically, the women just need to know their body, and then it's the early detection is also very key. Once the woman knows that, okay, it's as simple as a 12-year-old or a 13-year-old or a 15-year-old. From the first menstruation, you get to know about it, and then you do something about it. You just don't leave it to say, oh, just feel this way, or I just have hair on my chin, or I just have hair on my chest, and I just want to let it go, Or a woman that has a miscarriage, and then what happened, just say, oh, it's just a normal thing. No, it's not a normal thing. You need to find out what has happened. You need to be able to see your doctor, and you need to be able to detect early enough so that it doesn't run into other severe complications.
I want to say a very big thank you for joining us this morning and actually breaking all of this down for us. But I have one extra question for you that is out of PCOS. So when we're talking about healthy remedies for healthy home remedies for, people that have menstrual cramps or dysmenorrhea, I talked about sometimes if you're within a group of friends and you have your dates for menstruation, they have their dates for menstruation, but then you live together, and then all of a sudden, can you explain the magic that happens when at some point every one of you would have your menstruation around the same time, or probably days after each other, following each other? At times whereby you just realize that I have mine, she has hers, you have yours, and we don't have regular days.
Even like it's not time for her to actually see hers.
Yeah, like what's the magic behind it, or the science? Because like the times that I think about it, I'm like, how is this even possible?
Well, there is no magic about it. There's absolutely no magic about that. Yes, there is absolutely no magic about it. It's just the body, responding the way it ought to respond. So it's just coincidental that
Are you serious?
Yes,
it is coincidence.
Yes, it's just
It
coincidental.
happens a lot.
Wow, if you follow your circle, you find out that this happened on on the 22nd. This is 24th, and then it keeps going on. So it's just coincidental. For pains and during menstruation, it's just as a result of the high production of prostaglandins in the body. High prostaglandins from the uterus causes the uterus to contract. And so that is why the pain's coming. So also when you're talking about it, you talked about some people not even having any pains at all.
Yes.
Yeah, well, dysmenorrhea, for those that don't have pains at all, it is because their uterus is not producing as much prostaglandin as the other person's body is producing.
So you're saying is not okay that way?
No, it's okay. It's the body differs. Like we said, the first thing is always understand your body.
Yeah.
The body differs. So, for instance, you could have genes that do not make you fat, and I could have genes that make me fat.
Okay.
So, so our body differs. So if your body is producing high levels of prostaglandins, then definitely the uterus is producing high levels of prostaglandin, then definitely there's going to be dysmenorrhea, there's going to be high levels of pain, Like one of the remedies that you also mentioned, are just an addition to, you have people using bitter leaf. You find out that it actually lowers the production, the thins out, so to say. Like the hot water, that's just what it does. It keeps flushing as the uterus is producing the prostaglandins. Hot water bath, keeps flushing it out. Keeps so the body normalizes. So when there's the exercise, like we said, is difficult. But when there's exercise, the body generates heat,
Yeah.
So it's when the heat, gets into the body system, the same thing too, it begins to, take the prostaglandins, takes it out, and then it reduces the production of that hormone in the body.
Yeah.
And then, of course, the female feels better, and produces serotonin, like you said, and then, the female body feels better with it. So it's just coincidental. Every woman's circle differs from another. Every woman, there's no two circle that is the same. There's no two circle that is the same. Even if you start your menses on the same day, you could stop before another one.
Okay.
Yes, so you're not going to stop before the other. That shows you that it's just coincidental that the dates are just together. So
I want to say major thank you
you.
because you've actually broken down all of my questions, and thank you so much for coming through this morning on
Thank you for
Coffee
having
with
me.
Me.
It's a
We've just
pleasure.
spoken to Dr. Ahmadu Fatima Binta. She is a gynecologist, and we've talked about polycystic ovary syndrome. And yes, if you have this, please try as much as possible to see your physician immediately. It is very important that you do that. And yes, she said something about stigmatization and how body positivity and you actually loving yourself and getting comfortable in your own skin is what you should do. It is easier said than done, but it is not impossible. We want you to love yourself because, I mean, this is not a death sentence.
Yeah.
If you happen to have PCOS, it's something that can be regulated. You can actually get drugs for this if you see a physician on time.